Welcome to this explainer. Whenever we start talking about fertility planning, it can carry quite a bit of emotional weight. If you're feeling a mix of anxiety, curiosity, or honestly just a little overwhelmed right now, I want you to know that those feelings are completely valid. Taking steps to plan your future family is a big deal, but it really doesn't have to be a scary one. Today, we're going to look closely at the medical process of sperm freezing using clinical insights from ART Fertility Clinics. My goal today is to give you a really warm, supportive look at your options and basically turn what might feel like a confusing clinical maze into a clear, reassuring path forward. You're taking a huge proactive step just by being here with us.
To give you some peace of mind right off the bat, here is our roadmap for today. We'll start with a welcome to fertility preservation, look at who chooses sperm freezing, walk through the step-by-step process, dive into safety and success rates, and finally, look to the future.
Okay, let's dive right into Section 1. Welcome to Fertility Preservation, Understanding the Basics.
Taking control of your future family planning really starts with demystifying the medical jargon. A lot of the anxiety we feel around medical procedures comes simply from not knowing what the words mean. You're going to hear doctors use the word cryopreservation. Now, it sounds like something straight out of a sci-fi movie, but it literally just means sperm freezing. It's a safe, highly controlled medical process of preserving sperm cells by freezing them for future use in assisted reproductive treatments. That's the whole shebang. It's essentially a way of hitting the pause button on your reproductive health, keeping those cells totally safe and viable until you're absolutely ready to use them.
Moving on to Section 2. Who chooses sperm freezing? And spoiler alert, you are not alone.
You might be wondering if your specific situation is unusual, but the truth is so many individuals and couples walk this exact path for a ton of perfectly normal reasons. Let's look at why someone might choose to do this. For some guys, they're facing upcoming medical therapies like testicular cancer surgery, chemotherapy, or radiation, which can affect fertility. Freezing beforehand is a fantastic proactive safeguard. Others might be on long-term medical treatments where doctors actually advise against conceiving right away due to risks. But hey, it's not always about illness. Sometimes it's just pure logistics. If you won't be around during your partner's IVF cycle because of work travel or whatever it might be, having a frozen sample is the perfect backup plan. It's also a great option for men who might find it difficult to produce a sample under the intense pressure of a clinic visit, or for those who naturally have a very low sperm concentration. Oh, and of course, some men freeze their sperm simply because they're generously donating it.
Now, while there is absolutely no strict age limit here, it is often recommended to consider taking action in your 20s or 30s. Why? Well, simply because that's generally when sperm quality is naturally at its highest peak. It's really about locking in your best possible sample right now, so you don't have to stress about the natural decline in quality that just happens to all of us as we age. It's basically giving your future self some incredible peace of mind.
Next up is Section 3, the step-by-step process, and exactly what you can expect.
Now, what's really interesting about this part is how knowing the actual steps can just completely melt away your anxiety. When we break this down from some big, vague medical concept into clear steps, it's actually super manageable. So what exactly happens? First, when you're ready, a semen sample is collected. Next, we do a microscopic health check. The clinical team will literally count the sperm cells under a microscope just to make sure they are healthy and moving well. Once we confirm we have a good sample, we move straight to the freezing stage and then into safe storage. And years down the road, when you and your partner are ready for a pregnancy, that sample is simply thawed, warmed right back up to room temperature, and ready to fertilize the eggs.
Let's zoom in on that freezing step for a second. You might hear the clinical term vitrification. All vitrification really is a super fast freezing technique. By freezing the cells incredibly quickly, it stops any damaging ice crystals from forming. Depending on the size of the sample, your healthy sperm cells are safely tucked away in these highly secure, thin little storage tubes called ampules. They just rest there, perfectly protected.
I do want to take a moment here to address a very sensitive but super important question. For those who can ejaculate, the standard process is pretty straightforward. But what if providing a standard sample just isn't possible? This happens. It can be the case for young boys facing medical treatments or men dealing with specific physical challenges. It's a huge, heartbreaking worry for many families, but I want to assure you, the medical field hasn't left them behind.
For these specific situations, there's a procedure called testicular tissue freezing. This basically involves surgically removing a tiny amount of testicular tissue and freezing that instead. The idea is that down the line, the tissue can be thawed to retrieve sperm. Now, I want to be completely straight with you here, just as the clinical sources are. This is currently considered an experimental treatment. So far, there haven't been any live births in humans from this specific method. But it represents genuine, incredible scientific hope and future promise for young boys and men who otherwise wouldn't have any options at all.
All right, let's move into Section 4. Safety and success rates, focusing on your peace of mind. Once the sample is collected and safely stored away, it is totally natural to still have some lingering worries about the whole thing. You want to know that your future family is going to be safe. If you were sitting across from a doctor right this second, this is probably the very first thing you'd ask. Is freezing my sperm actually safe? It's the most important question of the day, right? Because we're talking about your future kids. Well, the answer is a resounding yes. Sperm freezing is highly safe and has been used successfully in fertility treatments for literal decades. And I really want you to take in this next point. Freezing your sperm does not increase the risk of congenital disabilities. Babies conceived using frozen sperm are just as perfectly healthy, vibrant, and normal as those conceived naturally or with fresh sperm. There is absolutely no compromise on the health of your future baby just because you chose to freeze.
Another incredibly common question we hear is all about the timeline. Life is totally unpredictable. You might freeze your sperm today, but maybe you haven't met the right partner yet, or you just don't feel ready to start a family for a very long time. So how long is that frozen sample actually good for?
Here's where it gets really amazing. As long as proper freezing and storage conditions are maintained at the clinic, your sperm can be safely stored for several years or even decades without losing any of its quality. It essentially locks your fertility in a time capsule. You absolutely don't have to rush your life plans. Your future family can safely wait until you are 100% ready.
So the crucial point is, does all this preparation actually work? You've done the work, you've stored the sample. Can you really achieve a successful pregnancy using this frozen sperm? Let's look at how these stored ampules translate into a growing family.
Yes, for sure. Pregnancy is highly possible. Once thawed, your frozen sperm acts exactly like fresh sperm. It is commonly used in several standard, highly successful fertility treatments. This includes IUI, where the sperm is placed directly into the uterus, IVF, where the egg and sperm are combined in a lab setting, and ICSI, where a single healthy sperm is injected directly into an egg. Now, keeping it real here, it's important to remember that a successful pregnancy doesn't rely solely on the sperm. The ultimate success is also going to depend on other vital factors, like egg quality, the woman's age, and the specific treatment plan your doctor recommends. But your frozen sperm, it is absolutely ready to do its part.
Which brings us to our final section, Section 5, Looking to the Future, Empowerment and Hope.
We've walked through the science, the steps, and the safety, but now I want to talk about shifting your perspective, moving from clinical uncertainty into a place of totally empowered family planning. It is so easy to view medical procedures as a burden, right? Especially if you're facing this because of an upcoming illness or a really stressful IVF schedule. But sperm freezing isn't just some clinical chore to check off a to-do list. It is an incredibly empowering, hopeful deposit into the bank of your future family. You are literally taking a proactive victory over uncertainty. By understanding this process, you're safeguarding your dreams and keeping your options wide open. So I'll leave you with this final thought. Knowing that modern science can safely pause time for your reproductive health, what beautiful possibilities does that open up for the rest of your life? Thank you so much for joining me in this explainer today, and I wish you nothing but absolute clarity and hope on your journey forward.